Hello, welcome to my YouTube channel. Today, I'll be talking about autoimmune diseases. The immune system is a complex network of organs, tissues, cells and proteins that defends the body against infections, whilst protecting the body's own cells. What is an autoimmune disease? An autoimmune disease is a condition in which your immune system attacks your body. The immune system usually guards against bacteria and viruses. When it senses these foreign invaders, it sends out an army of fighter cells to attack them. Usually, the immune system can tell the difference between foreign cells and your own cells. In an autoimmune disease, the immune system mistakes part of your body, like your joints or skin, as foreign. It releases proteins called autoantibodies that attack healthy cells. Some autoimmune diseases target only one organ. Type 1 diabetes damages the pancreas. Other diseases, like systemic lupus erythematosus, SLE, or lupus, can affect the whole body. Why does the immune system attack the body? Doctors don't know exactly what causes the immune system to misfire. Yet some people are more likely to get an autoimmune disease than others. According to a 2014 study, women get autoimmune diseases at a rate of about 2 to 1 compared to men. 6.4% of women versus 2.7% of men. The disease often starts during childbearing age, ages 15 to 44. Some autoimmune diseases are more common in certain ethnic groups. For example, lupus affects more African American and Hispanic people than white people. Certain autoimmune diseases, such as multiple sclerosis and lupus, run in families. Not every family member will necessarily have the same disease, but they inherit a susceptibility to an autoimmune condition. Because the incidence of autoimmune diseases is rising, researchers suspect environmental factors like infections and exposure to chemicals or solvents might also be involved. A Western diet is another suspected risk factor for developing an autoimmune disease. Eating high fat, high sugar, and highly processed foods are thought to be linked to inflammation, which might set off an immune response. But this hasn't been proven. Researchers don't know exactly what causes autoimmune diseases. Genetics, diet, infections, and exposure to chemicals might be involved. Autoimmune disease symptoms. The early symptoms of many autoimmune diseases are very similar, such as fatigue, achy muscles, swelling and redness, low-grade fever, trouble concentrating, numbness and tingling in the hands and feet, hair loss, skin rashes. Individual diseases can also have their own unique symptoms. For example, type 1 diabetes causes extreme thirst, weight loss, and fatigue. IBD causes belly pain, bloating, and diarrhea. With autoimmune diseases like psoriasis or RA, symptoms may come and go. A period of symptoms is called a flare-up. A period when the symptoms go away is called remission. Symptoms like fatigue, muscle aches, swelling, and redness could be signs of an autoimmune disease. Symptoms might come and go over time. When to see a doctor. See a doctor if you have symptoms of an autoimmune disease. You might need to visit a specialist, depending on the type of disease you have. Rheumatologists treat joint diseases like rheumatoid arthritis and other autoimmune diseases like Sjogren's syndrome and SLE. Gastroenterologists treat diseases of the GI tract, such as celiac and Crohn's disease. Endocrinologists treat conditions of the glands, including Graves' disease, Hashimoto's thyroiditis, and Addison's disease. Dermatologists treat skin conditions, such as psoriasis. Tests that diagnose autoimmune diseases. No single test can diagnose most autoimmune diseases. A doctor will use tests, review your symptoms, and conduct a physical examination to reach a diagnosis. Doctors often use the anti-nuclear antibody test, ANA, when symptoms suggest an autoimmune disease. A positive test means you may have one of these diseases, but it won't confirm exactly which one you have or if you have one for sure. Other tests look for specific autoantibodies produced in certain autoimmune diseases. Your doctor might also do nonspecific tests to check for the inflammation these diseases produce in the body. A positive ANA blood test may indicate an autoimmune disease. Your doctor can use your symptoms and other tests to confirm the diagnosis. How are autoimmune diseases treated? Treatments can't cure autoimmune diseases, but they can control the overactive immune response and bring down inflammation or at least reduce pain and inflammation. Drugs used to treat these conditions include nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Motrin, Advil, and naproxen, naproxen. Immune-suppressing drugs. Treatments are also available to relieve symptoms like pain, swelling, fatigue, and skin rashes. Eating a well-balanced diet and getting regular exercise may also help you feel better. The main treatment for autoimmune diseases is with medications that bring down inflammation and calm the overactive immune response. Treatments can also help relieve symptoms. More than 80 autoimmune diseases exist. Often their symptoms overlap, making them hard to diagnose. Autoimmune diseases are more common in women and often run in families. Thank you for watching. Please subscribe to this channel for more videos and don't forget to click on the notification button to receive notifications on my new videos.